Okay, this is the video for CAT-2. The first thing I'm going to do is test leg lengths on my patient, supine. I'm going to bring them together and I'm going to look at the medial malleolus, which one is more superior. He's got a right short leg. So that's going to indicate which arm I do my arm fossa test on. So I'm going to come over here, have the patient make a fist, and put your arm up. I'm going to hold, contact the upper pole, and he's strung right there. Hold, and lower pole, and he becomes weak. So the next thing I'm going to do is the congruency test to indicate that the patient can be blocked. So if it was an upper pole, he would have medial knee pain on the short leg, those three things, but since he was weak on the lower pole, he should have lateral knee pain on the long leg. And is this tender? Yeah, it is. Okay, so that indicates that we can do the blocking for CAT-2. So what we're going to do is, it's active blocking with the patient's help. I'm going to have him bend his leg like this, and I'm going to put the first block for the short leg side. It's going to be perpendicular to the spine, halfway on the iliac crest and halfway on the lumbar muscles. And then the other side, and bend this leg, it's going to be under the acetabulum at a 45-degree angle pointing up towards the other side. So, and you only hold this for a maximum of 2 minutes, just as I've blocked him, and make sure the pelvis is straight and make sure that he's responding well to it. I'm going to redo the arm fossa test if one of them is getting worse, or we're looking for balance, but if any of them are getting worse, you need to pull them out, retest, reblock, because you've done something wrong. So the next thing that we come to is the augmentation, block augmentation. So the first thing you do, of course, would be to move them. Second thing to do would be to bilaterally apply pressure on the thighs for 10 seconds, A to P. Another thing you could do is contract the upper pelvis and lower on the opposite sides, not over the blocks, and you hold an A to P pressure for 10 seconds on those. And then the fourth thing that you could do is basic 2. So basic 2, you're checking for cranial faults. We're going to do the arm fossa test again. I'm going to have the patient inhale all the way. I'm going to contact the strong fossa. Inhale all the way. And I'm going to check that. Okay. Now exhale all the way. And so when he was weak on exhalation, that means he has an exhalation fault. If it was an inhalation fault, you would correct on exhalation. Since he has an exhalation fault, we're going to correct on inhalation. We're going to come over here. My left hand is going to go under his occiput, my right hand on his frontal bone. I'm going to have the patient, I'm going to tell the patient to bring their tongue to the roof of their mouth, point their toes towards me, and inhale. And as he does, I'm going to push S to I on the cranials and relax on exhalation. And that is the end of basic 2. And then to set that, I'm going to do a reverse AFT arm fossa test. So I'm going to have you put your arm up again, and you're going to push against me this time as I contact, and that's going to set it, just like that. Now the short leg, long leg technique, I'm going to come to the short leg, his right leg. I'm going to grab it like this. We're going to do this 3 times, going lateral to medial and out, lateral to medial and out, lateral to medial and out. And then I'm going to do the same kind of thing on his other leg, except for we're going to go medial to lateral. So medial to lateral, and I'm doing this to help mobilize the pelvis. And then the next thing would be the sacral cut. So we're going to move the blocks. I'm going to have you flip over. So I'm going to have the patient lift one leg 30 degrees off of the table, and I'm going to test for strength, have him do the other one. And that one went a little weaker than the first one. So I would do the same test on that leg while applying pressure on both poles of the sacral cup. And so that made it a lot stronger. I'm going to go ahead and test the other side as well. That didn't really help. So the side, you would do, what to adjust is the part that made it stronger. So this is the upper part. I would apply pressure for 10 seconds and then retest. And that should be a lot stronger. And that's the end.